Hi, my name is Sarah Bentley Pearson, and I am excited to share my podcast, which features wonderful talent that I've been so lucky to discover in the Southeast. This was born out of a list that I created in 2015 called Sarah's List. And through my work in real estate, which I've been doing since 2005, and styling work, and just my personal life and my personal interests, I've been able to meet so many wonderful people, and I'm excited to share them with you. Eva, thank you so much for coming here, Dr. Eva Arkin. You really are very well known. Lisa Stein gave me your information years ago, but I've sent a lot of people to you, but I know a lot of people who go to your practice, and we'll get into your practice because I'm very impressed with how you got started. But thank you for
Oh,
coming.
thank you, Sarah. It's been a joy being invited here by you.
Oh, wow. Thank you so much. Well, I think what's special about your practice and what I was told about your practice is obviously I had a child later in life at 37 and wanted, that practice. I was Dr. Garcia, had my, was the doctor for my son. And I mean, there were so many people in that practice. Every time I went there, you'd have to wait forever. And it was a baby making mill. So Lisa referred me to your practice because then your body starts changing and that's what you focus on.
Well, one thing about our practice, which I started many years ago, actually 27 years ago, was that I wanted to provide a practice where women could come, feel comfortable, and have health care for women by women, which is our tagline, and feel comfortable that they can be cared for in all stages. And so we do focus on the young teenager girls. Our main focus is as women are aging, but their individual problems. We have more time to spend with women on their problems, but also carrying women through their different life stages, especially through the menopause, which is not talked about enough. And there are so many areas of misinformation online that when they want to come for real answers and guidelines, many women feel comfortable coming to our practice because just like you, many of us women had very similar stories. Many of us, we can make them feel comfortable. For example, I had a baby in my 40s. Several of my other partners had babies in their 40s. We do talk about that. We do talk about aging and their gynecological health and what it takes to maintain that health. And I also think that happily I'm surrounded by wonderful female doctor partners, and we all imbue to our patients what it means to try and strive for that healthy goal or that healthy life because we emulate that ourselves.
Mm. Yeah, I had Dr. Lyle on our podcast, and I brought my blood work that she drew to you, and that you both have kind of been working on me together. It seems, and I think we spoke a lot about menopause and how it was presenting. And it's interesting, like many things, when you grow up, you feel like, well, why didn't my parents talk to me about this? But, my experiences of my body changing, I mean, I'm still getting my period, but everything has been changing for years. I think you first put me on progesterone, and then we added estrogen, and then a little testosterone, and then we up it and we down it. And it's constant tweaking.
Well, that's the story of the human body, which is what's so fascinating. And the nice thing is that we do take time to individualize the therapy, the treatment. And yes, you do change. Life is not static. We are human beings, and that's the mystery and the marvel of medicine and being in medicine is that people change, women change, their hormones change. The way you are at 48 is not necessarily how you're going to feel at 52 or 58. And yet, I have some women who are, 75 and they're like, when are these hot flashes going to end? And so we treat them as individuals because every day is a new day, every phase is a new phase. And so we do need to understand that we need to tweak their um, hormones or offer them non-hormonal if they're not candidates for offer them non-hormonal options to help them strive for that quality of life that they're seeking.
Hmm. Yeah, I think, I thought one of the things that was interesting was um, the fact that Dr. Lyle, it was started out a compound pharmacist, and she was saying that, you know, back in the 70s, a lot of women were, taking Valium all the time, obviously to deal with
Right.
menopause, but didn't really, they just kind of thought they were losing their crap. And that, it, I wanted to talk to you about what are the typical things that women should be expecting through menopause, and what is the typical sort of leveling out from it, and how does it really look for a woman?
So I'd like to first of all answer your questions, but dispel a couple of myths.
Okay.
Um, menopause for a lot of women in their mind, they feel like it's kind of like a cold that you're going to get over. I get very frequently asked, like, when am I over menopause? But the bottom line is that a woman is either producing hormones and her ovaries are functioning or they're not functioning. And then of course there's that transition where some months they're going to function and some months, and we call that the perimenopause. Again, there's no rule. Every woman's body is different. You may be going through perimenopause for 1 year, 2 years, 5 years, 7 years, where your hormones start to drop.
Mm-hmm.
I kind of liken it because I do ski. Always give analogies. I love giving analogies, but it's kind of like some women go through menopause down the double black diamond slope. They start at the top and in 2 seconds, they're down at the bottom. They went straight into menopause. They blinked an eye in 1 month. They stopped their periods and they were symptomatic of menopause. Other women go through menopause kind of like going down on the bunny slope where they are doing what they call the catwalk, which they go down so slowly. And it's almost a painful kind of perimenopause because it lasts for years. So menopause means menses stopping or menses pausing. And the definition in this country, and average age is 51 in this country, but the definition is no period for a year. Now, of course, many women do feel symptomatic. They start getting hot flashes, sometimes years before they really stop their periods. And sometimes they will go ahead and have hot flashes, night sweats, and they'll have periods that are maybe every 2 or 3 months. And so that's a challenge to treat because you want to give them something to help their hot flashes, but not also make their bleeding worse as well. But again, we welcome those challenges. Every woman is individual. The problem is this day and age, we have so much information and misinformation that they go immediately to doing some research online and they try and put themselves into a box, into a category and go like, well, I'm wondering if I'm fitting into this category or not. And that's where we come in as far as individualizing therapy, taking a good history, figuring out um, exactly where they are, doing some blood work, um, and then checking to see what they individually need because only they know what is their most bothersome symptom that is hindering their quality of life. It's really about their quality of life
Mm-hmm.
that they're seeking.
Right.
And so you have to go ahead and and then have them come back often enough, like you said, because it does change. I mean, where you are at 48 may not be where you are at 52, which is where you may not be at 62. But
Mm-hmm.
yet the symptoms are all an evolution of menopause. You just need somebody who is going to understand your menopause, your individual menopause.
Right. So, like humans, we're all very different, and probably with some links in the process. But it does seem. I mean, my mother stopped getting her period, I think, at like 40 or 41, and I'm 53 and still getting it. So our bodies were very different, and just our energy and our temperament. was very different, so I think it's fascinating.
It is fascinating. And although a lot of women do feel like there is some genetic link to when they are going to match their mother's menopause, that's not really true at all. And, the
Mm.
only time that it actually makes a difference is if somebody really goes through um, menopause at a very, very young age. And if they have what we call premature menopause. Now, again, 41 is pretty young.
Mhm.
But again, obviously not a genetic phenomenon for you.
So, one of the things that's a true difference between me and my mother were our lifestyles. And this is a question that I have regarding menopause and all of that is that my mother drank regularly, which a lot of people did back then. It was like
Hmm.
come home from work and they'd have wine and one glass turned into three or four or whatever. And she smoked cigarettes and she did not exercise.
Right.
So, what does lifestyle have to do with how your body reacts to the changes?
Well, we know that so many things interfere with your hormonal balance. So many things. I mean, that's why it is so important to look at yourself as an individual and basically come to somebody like us where we can take a good history because things like smoking affect your hormones, stress, physical stress,
But let me interrupt.
immunological.
Let me
Yeah.
interrupt one thing. People lie to their doctors.
Oh, all the time.
And
All the
on your
time.
questions, it said, when is the last time you've had three or more drinks? I think in one sitting. I haven't had 3 or more drinks in, like, 2 decades or at least a decade,
Right.
but I was like, there's some people lying on this." So
I have many examples of that. In fact, I have one patient who, well, several patients who never ever said anything on our form about drinking. And this is the point where you have to be honest with your doctor. But again, it did come out years later that she had an issue with that. And, I feel bad that some patients are so embarrassed by what they do, or at least not wanting to acknowledge it, maybe for fear of my judging them, which I don't. I'm here
to
to
help.
help.
Right. And
Exactly.
how can you
And
help if somebody isn't honest?
right.
But I know people lie to their doctors all the
Yes.
time. I know one person who smokes like over a pack a day and doesn't tell the doctor because the insurance doesn't know. And I'm like, "Oh, well, if I mean, I'm sure something could happen and the insurance would figure it out in 2 seconds." And
Most of us can kind of sort of tell when somebody's smoking. There's an aura and smell about the smoke that's definitely there. But I do think that one's lifestyle today is very different. Going back to your story about your mother,
Mhm.
and that was then. And I think there's so much more focus on how to get your life better nowadays. Everything from the multiple options of skincare products and vitamin C serum and retin A and all the things that we want to do, and all the focus on exercise that most of us want to do. Obviously, there's a whole segment of the population who doesn't exercise, but there's most of us who want to exercise. You've got a yoga studio here. Many of us either have exercise equipment of some sort or go out walking or belong to a gym or whatever. But this is a very different mindset than my mother and your mother, who was very content to sit next to the kitchen table smoking and drinking wine in the evening. And I was at the gym yesterday evening. So,
Yes, right.
there's the
Well,
dichotomy
it's
of
yeah, and it's also it's the culture has changed,
right.
and really, but just coming back from Switzerland myself, I was, we sort of think of Switzerland as like super sophisticated and blah blah blah. Everybody was smoking.
Well, that's true with a lot of Europe,
And I
though.
was just like gross. And frankly, you know, women looked older to me there. I think so it of course, some didn't, but we live in this little bubble here called Buckhead, and everybody's pretty athletic and taking pretty good care of themselves because it's more educated base or whatever. But it doesn't take long to kind of go out and see things look differently. But what does smoking do for menopause? And
Well,
this includes vaping too. I'm sure it's
of
the same.
course, of
Okay.
course. Well, it's one huge negative thing on your body with regards to smoking. It on top of when you go through menopause, you basically have very, very little energy because menopause disrupts your sleep.
Mm,
That is one of the things people have disrupted sleep. They have very little what we call REM sleep, which is that rapid eye movement, which is the deep sleep. So you're already functioning on lower energy. And then when you smoke, of course, you've got less energy because of the fact that you're smoking and it affects the red blood cells and your oxygenation. So, you definitely don't have energy enough to go out and physically keep yourself fit. And if you don't keep yourself physically fit, or you're too tired to eat properly, and then you're just going to grab something unhealthy on the go, then you're putting bad things in your body, and then the whole bad cycle goes on and on and on. But smoking also does not, it depletes your energy, and
mm.
it also gives you a risk for higher risk for heart disease, stroke, cancers. It's just a whole bad entity unto itself. And it says so on the pack of the cigarettes that you are going to die from keeping on smoking. There are 200 something carcinogens in each cigarette. So even for those people who feel like they're only smoking 2 cigarettes a day, in your body, that may be all that you need in order to set up some form of irritation. But any symptom of menopause is going to be exacerbated by smoking. And menopause has enough symptoms on its own. You don't need to be aggravating it to begin with.
And what do you feel about drinking? I listened to the podcast, the Huberman Lab. He's great, Stanford doctor and or professor rather. And he did a whole thing on alcohol. And so back to our mothers, when my mother was growing up, there was a theory of like, wine is good for you or whatever. And now we have really come to the place that actually any drink you take, you're putting a little stress on your body. And I drink very, very moderately, like maybe one or two a week or every other week. But even when I do that, I feel a little drained or a little tired because my body is sensitive. But what is your opinion on drinking? Would you say it's optimal to just not drink at all? Are you of that opinion
I
now?
think what you do is perfect. I mean, if you have a social drink, one here or there, it's fine. Absolutely fine. I know that there are whole countries like Italy that and France that probably drink wine every day, but unlike us, our portions in this country, everything is a mega portion. The beauty of some of these countries like Italy and France, everything is tiny, tiny portions and even limited portions.
Mhm.
Um, so the one thing when you relate drinking to menopause is that drinking already causes you to flush, and a lot of your menopause symptoms will be exacerbated, made worse by drinking. So you don't need to have anything make you feel worse. What you're seeking is how are you going to go ahead and be better? And I think many, many women now are looking towards how am I going to make myself better? The big hurdle and the big roadblock is how do I get out of my rut? How do I get out of my routine? How do I make that change? For some women, it's a very big leap to change their routine and their rut routine that they do all the time to say, okay, now I'm not going to eat carbs. Okay, now I'm not going to eat sugar. Okay, I'm not going to drink all that wine. I'm going to go ahead and make time to do exercise and eat right. That's a huge hurdle for a lot of women.
Mm,
You and I do it because that's our lifestyle.
right.
But for women who have to change that lifestyle, that is a huge hurdle. And I try and help them by saying, let's just tackle one thing at a time. Let's just cut out some of your